So this is what gout looks like. It's a type of inflammatory arthritis that happens when too much uric acid builds up in the joints. And it typically happens in this big toe joint. And when there's a flare, it's this really throbbing, intense pain that's hot to the touch. And sometimes you can't even put bed sheets over your toe. It's that painful. So a high amount of uric acid in the blood is what's responsible for causing gout, and this can happen for a number of reasons. So one, men are at a higher risk, and this is intertwined with family history, so there's a genetic component as well. Being chronically dehydrated, about 70% of our uric acid is excreted through the kidneys, so drink your water and take care of your kidneys, as well as chronic conditions are intertwined with all of this. So if you have high blood pressure, a chronic kidney disease, heart failure, this also increases your risk of gout. And certain medications can also do this, like being on a diuretic or taking low-dose aspirin. And one of the controllable risk factors is the diet. So as you can see, foods with high fructose corn syrup, beer, alcohol, red meat, fish, these are all things that contain a high amount of purines, which then get broken down into uric acid. As for treatment, a good start is introducing some vitamin C and antioxidant-rich foods. So they've got cherries, oranges, that also includes blueberries, bell peppers, kale, broccoli. So this is because vitamin C can actually help lower uric acid levels in the blood, and antioxidants can help to dampen some of the inflammatory processes during a gout flare. But diet doesn't exactly work immediately, so that's why we have colchicine. It's an anti-inflammatory medication, and it doesn't work for pain like an NSAID, but what it does do is it blocks tubulin, a protein that's responsible in the outside of white blood cells called neutrophils that allow them to move to the site where there's inflammation. So it doesn't stop the production, it just stops them from going to do the inflammation at your big toe. And if we go back to this diagram, we've got a nice little enzyme called xanthine oxidase that converts xanthine into uric acid. So we can use allopurinol, which is a xanthine oxidase inhibitor, and that way we don't even form uric acid in the first place. Colchicine's cool because you only have to use it for the first few days that you have your flare onset, but if your uric acid levels stay elevated, you might end up having to be on allopurinol for the rest of your life. But this doesn't have to be the case. So this is a reminder for you to get some vitamin C and antioxidant-rich foods into your diet and stay hydrated. Thanks for watching.